Hi, it's Dr. Kuyunov here at Dental Prosthodontics of Rochester. I'm here to answer a few questions about myths and misconceptions people may have about dentistry. Is it true that dental needles are really big and painful? There is some truth to it, to be honest with you. However, with proper skill, it really should not be painful. Previous experience with of patients can really contribute to anxiety from needles, but it does not need to be so. A lot of patients do report that they did not even feel the needle or they did not even know that the shot was given. So with proper skill, taking your time in giving local anesthesia, it really should be at the minimum and should be really the only thing that you will experience at all at a dental office. Is the implant screw is actually huge. Implant screws, they come in different diameters and different lengths, and every situation is prescribed what type of implant to use. Sometimes we use very small implants. We speak about 6 millimeters in height and 5 millimeters in diameter. Sometimes the implants that are being used are longer, and this can be 12 millimeters in length, sometimes even 14 millimeters in length. Every situation is different, and it's really specific to a patient and to a situation. Relatively speaking, they are not longer than a tooth root itself. So whatever the tooth root was, the implant on average will not be longer. More commonly, it's actually shorter than the tooth root itself. Does getting anesthesia always hurts? No, it's not always hurts. However, if you have a anticipation and anxiety, a pinprick might be felt. However, before giving the anesthesia, often we put topical numbing agent, and this really takes away most of the pain that local anesthesia needle can give. And with proper technique, the pinprick of needle really should not be felt much. Will the dentist force your mouth to be open wide the whole time? That's really a good question. You do not have to hold your mouth open the whole time. Nowadays, if the procedure is long and we need to have your mouth open, we usually place a device in between your teeth that will hold it open so you can fully relax your muscles and you do not have to think about opening your mouth. You can just rest it on the device and we'll finish the work while having this device in your mouth. And then when we are done, we'll remove it and it'll be okay. If the mouth is open for extensive amounts of time, when we speak about an hour, 2 hours, sometimes 3 hours, even if we view the device, there is still some pressure on the joints that open the mouth. And this pressure can produce post-operative sensitivity and some pain. So in cases like this, I do recommend taking some medications for pain. Usually these are going to be NSAIDs, such as ibuprofen with a high dose, 600, 800 milligrams. Really depends on the patient, age, and the medical condition. And usually this will take away any post-op sensitivity or any sensitivity that would come otherwise. These medications will be taken for the next 2-3 days only. It's a short time, but it's very helpful. And that's only for procedures that are longer. For short procedures, such as half an hour, 40 minutes, there shouldn't be any problem with pain in your muscle joints. Is dental treatment always painful? No, it's not. Pain is subjective, and some people will feel it more, some people will feel it less, but dental treatment does not have to be painful. The treatment is provided under conditions of local anesthesia, and except for the giving the local anesthesia, whatever comes afterwards should not be in pain. Treatment should not be provided under pain. You should be completely pain-free during treatment. If it's not so, then something is not being addressed. So local anesthesia should remove any pain associated with dental treatment. If nothing hurts, does it mean everything is fine? No, it does not mean that everything is fine. Many times it is fine. Nothing hurts, it's good. However, some of the oral conditions are termed as silent diseases, meaning it's silent because it doesn't really hurt, but there is still disease there. Most commonly, this could be a gum disease, a periodontal condition, gingivitis, periodontitis. These are gum conditions that when the gums are inflamed and are not doing well, patients do not feel any pain. There is no pain. However, this inflammation is not very healthy. Sometimes we have an extreme tooth pain that the patient had, and throughout this pain, the nerve has died as a subsequent of this pain. Afterwards, there is no more tooth pain. The nerve has died. However, the infection is still there. The pain came from a tooth decay and it progressed to the nerve, and now it's actually deep within bone structure, and there is communication to bloodstream, and it can travel to other parts of the body, and it can affect other parts of the body as well. So the infection was not treated, the tooth decay was not treated, but there is no pain. But there is a big problem, and if it's not addressed timely and properly, it may cause damage. So even though there is no pain with teeth or gums, it does not always mean that there is no problem. The best way to find out if everything is okay is really to see your dentist, have the proper diagnosis, proper exam. And if everything is good, then you are good. But if there is any problem and you're not in pain, the problem will need to be addressed. I hope I was able to address some of your questions about myths and misconceptions. If you would like to schedule an appointment with us, please reach out to our office. Our phone number is 585 471 5689. Thank you.